The Denver Sheriff's Department is taking a more comprehensive approach for those individuals in their custody by identifying and providing care for mental health issues. We spoke with Andrew Harris, an inmate who is a participant in the Mental Health Step-Down Unit.
After leaving Connecticut because of incidences with being an ex-gang member, and a few of my friends robbed two 24-hour stores in a bank back home where I'm from, so I wasn't really welcome around there. I've never really gotten addicted to any hard drugs. I was always into pot. Getting to know people, I always loved people, so I was willing to do what they were doing just to be around them. So for the last 5 months before I got locked up, I started smoking meth. And it just sent me in a downward spiral.
For me, it's about recognizing what we need to do to help people. That's what the folks that are in our custody are. They're a part of our community, and everything that we can do for them while they're in our custody is going to be beneficial for every single person in the city and county of Denver. In the 27 years that I've been with the department, I can tell you that the number of folks that have mental health conditions that has come into the custody of the Denver Sheriff's Department has grown tremendously. What we have been doing for many, many years isn't working. And so it's about taking a pause, stopping, realizing how we can really get to the problem, which oftentimes is people are committing crimes because they have addictions, because they have mental health conditions, because they're not able to afford the medication, or they're self-medicating with drugs or alcohol, which causes them to commit crime. So it's a big circle. So if we can stop, pause, address their mental health condition, perhaps we can stop them from doing the other things that cause them to spiral and stay inside of the system. When I became the sheriff, one of the priorities that I wanted to have for our department was elevating the position that Dr. Johnson now fills.
Currently, we have started a mental health step-down unit here at the Downtown Detention Center. We've designed more of an incentive program, so they're able to get things like radio headphones to use as coping skills and various library services. So some of our clients are on medications and some choose not to be. You know, we're talking about different psychotropic medications for mental illness, and for some of them it's really important that they stay on those medications. We do look for individuals who have at least 4 weeks within our custody to truly get the solution-focused therapy, and we'll meet with them for approximately 8 weeks for 50-minute sessions and work on whatever has come up for them. We're really encouraging the deputies in this unit to work with the incarcerated individuals on their behavior, and not necessarily take as much of a punitive approach as traditional jails may take. We know that the majority of individuals within our custody will get out, and so it's important for us to ensure that we're doing everything we can to prepare them for that.
I can tell you that it's a welcome approach by the deputies. They have been asking for resources like this for many, many years. So for them to have folks that can come on board to work beside them in this capacity is going to be tremendous. It's been a welcome addition, and we've had a lot of our deputies who have not only said that, but who have participated and have been helping Dr. Johnson.
We started out, we utilized about approximately 20 participants in the original program over in the 8-man unit, and it was nice to see the transformation and the articulation from them getting used to being from a 23-1. Some of these folks have never had a cellmate. Some of these folks only came out 1 hour a day. Some of these individuals chose not to come out at all for days at a time. And then now you have them in a cell with 5 other individuals. And you could see that, you know, the transformation through the days, it was very positive.
I've grown a lot while I've been in this program. It allows people an opportunity to feel safe. It allows people an opportunity to try to grow. Through this program, I've learned a lot about myself, and I've been allowed the opportunity to not be around people that are more, like criminal-minded. I don't need anybody to teach me how to be a criminal. I need people to teach me how to be a successful person so that I can be out there for my family and loved ones.
For more stories, check out Denver's YouTube page or tune in to denver8.tv.